Welcome to the Nursing and Staff Orientation video from Clinical Scribes, LLC. My name is Kyle Kingsley. I'm Medical Director for Clinical Scribes, and I'd like to thank you for the opportunity to talk to you briefly about how scribes work in the primary care clinic setting. What are scribes? Scribes are essentially trained paraprofessionals who assist physicians with their documentation. Often they're college students who are either pre-med or pre-nursing students. They're generally not medically trained other than our specific scribe training, and they have extensive training in HIPAA and privacy. What do the scribes do? They are attached to the physicians at the hip, generally speaking. They perform documentation and EMR entry for physicians. They also perform logistical tasks for physicians, such as locating lab results or running down information that the physician needs. They may ask nursing and staff for additional information from time to time to put into the medical note. What don't scribes do? They don't provide patient care or assistance to nursing staff other than basic information, etc. They're not allowed to touch patients or help physically with patients. They're also not able to perform independent medical decision-making. They're not able to stay in the rooms without physicians present. They do not enter or finalize notes, and they do not write prescriptions. What can you expect with scribes present? Generally, there's limited interaction with staff with the scribes because they do have a busy job and their focus is on the physician documentation. I would just ask that if you please could be helpful with the scribes and they ask you something, even if the reciprocal is not necessarily true. Effective scribes make for happy physicians, which hopefully will get back to you. Limiting the physician's documentation time makes everybody happier, including patients, staff, etc. Generally speaking, nursing and ancillary staff are very excited to have scribes after a month or so. The company strongly discourages non-medical conversation during shifts, and so please understand if the scribes seem less than friendly. This is the reason why. Some physicians may become completely focused on informing the scribe, and they may overlook informing nursing staff adequately. This is something that we do address with physicians in our orientation videos directed at the docs. Increased physician communication while in the room will take place with the scribe. The scribe will be in the room for most aspects of the exam, with the exception of sensitive exams, obviously. The scribes will be taking up computer space in the clinic, and as I mentioned before, sometimes there is a little bit less communication with physicians and nursing staff. So how can you help with the scribe program? Initiation of a scribe program takes time, and we really do ask that you help in any way that you can. We all understand that the nursing staff and ancillary staff is the real thing that makes clinics work. If asked what the scribes do or why they are used, a good answer is the doctors use them so they can spend more time with their patients. This sounds very corny, but this really is a good driver of patient satisfaction scores. This has been validated. Who should you contact with any questions? We would invite you to contact the head scribe or one of the administrative leads for your clinic. We also invite you to contact us directly at Clinical Scribes, LLC. We very much welcome your questions and thank you for your support. This is the end of our introduction video, and again, I'd invite you to visit us at clinicalscribes.com with any questions or concerns. Thank you so much for your time.